Welcome to the Australian Prescriber Podcast. Australian Prescriber, independent, peer-reviewed and free.
Hi, I'm Jo Chia, your host for this episode of the Australian Prescriber Podcast. Today, I'd like to welcome Amanda Wheeler, who is a Professor of Mental Health at Griffith University in Brisbane. Together with her team, Amanda has written the article Returning Unwanted Medicines to Pharmacies, Prescribing to Reduce Waste in the June edition of the Australian Prescriber. Amanda, welcome, and thanks for taking the time to speak with me today.
Thanks, Jo.
So, Amanda, could you perhaps just tell us briefly about the RUM project and what it actually stands for?
Yep, sure. The RUM project stands for Return Unwanted Medicines. Some other people call it the Yellow Bin Project, but basically it's a project that's been available in Australia since around 1998. It's an initiative that's been funded by the federal government, and it provides everyone in Australia who's living here with a free and convenient way to dispose of their unwanted medicines. So that includes things that have expired, packets they've opened they don't need anymore, any kind of medicines that they just don't need to have in the house anymore. They can take them to their pharmacy, and that community pharmacy will organise for safe collection of that. They put them all into a big yellow storage bin, and then they're collected and they're disposed of in a way that's environmentally safe.
Okay, so that's a really good introduction to the topic. So why is the RUM project actually, why is it important, and what made you interested in the RUM project to start with?
Well, I think most of us have medicines that we no longer need or that have expired, and we don't realise they've sort of accumulated in our bathroom cabinets and our kitchen cupboards. Mm-hmm. And we don't sort of think about it. But I think storing unwanted medicines in the home, we know it can actually be dangerous. So keeping expired medicines, medicines that they may no longer be effective, and in some cases they may be toxic or harmful to you, such as eye drops. And if medicines end up in the wrong hands, they can cause harm from accidental ingestion. And so I suppose we think logically of, worrying about children, but also pets if they consume them accidentally.
So for people who don't know, why can't we throw out our, medication in the bin or pour the liquids down the sink? I think a lot of people do that just naturally without knowing the consequences.
Yeah. Look, if we put medicines into our general household rubbish or flush them down the toilet, they actually end up in landfill or straight away into the waterways, so they can actually damage the environment. And then there's been research to show that they can have an effect on plant and animal life. And there's the potential there, although we don't have all the evidence at the moment, there's potential there for that they may harm human lives as well.
Okay, so that's really interesting because I don't think a lot of people would, necessarily think about the environmental impact of throwing their tablets in the bin, and so it's good for you to clear that up for us. So what kind of medicines are being returned, and the most common ones that you've mentioned in your article, why do you think these are the ones that are being returned?
Well, I'll just go back. We at Griffith University were asked to do an evaluation of the contents of the bins to see what was actually being returned. So we actually looked at 423 bins that had been collected from pharmacies all around Australia. And there were more than 30,000 different medicine items in those bins. Most of those medicines were prescription medicines that had been prescribed by a doctor. There was a smaller amount of medicines that you could buy in a pharmacy and medicines that have been dispensed in blister packs or dose administration aids. And when we looked at those medicines, the most common medicines being prescribed were also being discarded when they were unwanted or expired. But the actual top three return medicines were for the treatment of acute conditions. So they were things like paracetamol for as an analgesic, salbutamol for asthma attacks, and glycerol trinitrate for angina attacks. So they were things being used for short-term conditions.
Okay, so the RUM project is a subsidised national scheme, and in your article you've written that the cost of wasted medicines discarded via the RUM project is approximately $11.6 million a year. So this figure, is this a good figure? Is the project working? Do you have any comments about that?
Yeah, look, I think it's hard to, what's the cost of waste? How do we reduce waste? And I think there's been a lot of work done in the UK to look at how to reduce waste. But realistically, there's never going to be a situation when there are no wasted medicines. I mean, people are not going to tolerate some medicines. People need to have them. Sometimes they need to have them at home in case of emergency, but then they'll go out of date. And the right thing is that they've got them there and then they discard them once they've gone out of date. So we're always going to have wasted medicines. And in fact, probably the better thing to focus on is getting people to clean out their medicine cabinets regularly and return their unwanted medicines via the RUM project. And we want people to use this service. And I think that's everyone's responsibility, not just pharmacists to remind people. I think we kind of think it's logical that pharmacists would play a primary role in raising awareness. But I think it's every health professional's responsibility, especially if they know they're changing someone's medicines, if they're being discharged from hospital, lots of medicines have been stopped, or perhaps even when someone's passed away.
Mm-hmm. Yeah, that's a really good point, especially, if patients are going into hospitals, there's a lot of medication changes. We do often say, do you want us to hold on to these medicines and actually discard them for you? Sometimes we get patients or families saying, oh, actually, I want to hold on to that just in case.
Just in case.
Yeah, so, that's quite a common thing that happens.
That comes back to education. I think we need to talk to people when they understand why we're trying to minimise accumulation. I think most people, it's a role for education for health professionals. I think also, having said that, there is a role for everyone, and that's health professionals, but also consumers, to really be aware of what medicines they are actually needed, especially, regular medicines and, if required, medicines. So that means when we're prescribing medicines, when medicines are being dispensed, and when consumers are actually requesting repeats.
So are there any tips or strategies that you'd have for doctors or pharmacists in their, daily practice to reduce waste, or, anything we should be saying to patients in particular?
Well, I think raising some of those things. So before a doctor goes to write out a repeat prescription or send a repeat prescription, perhaps when someone's rung to request it, actually prompting and saying, have you checked which ones you actually need? I see you've got 3 that are regular, and obviously they're really important. We don't want to, it's that hard balance between making sure that people have got access to the medicines they need when they need them, but not actually having a lot so that they do start accumulating. And I think that's probably, particularly for if required medicines, then we need to probably ask. So doctors need to ask before they're prescribing, how much does someone actually need? Pharmacists need to check if required medicines are needed. So it comes back to that education, so the counselling role, but also remembering just to ask, I think.
And it's you've made a good point in regards to, the when needed medicines. Often in hospital, we see opioids are prescribed following surgery. These are prescribed on discharge and the pharmacist dispense it. But then your article said that, actually a lot of patients aren't using these opioids following surgery.
I mean, I think especially with opioid medicines, things that are potentially dangerous to have in the home for accidental ingestion, but they're also a safety issue as well. There've been cases of people being targeted because they know they have been provided with a large amount of an opioid medicine. So I think that research that came, I think, out of the United States found that up to 70% of opioids that were prescribed or dispensed after surgery actually went unused. And if they're needing something for more than that time that's longer than you would the prescriber would expect, then they have a follow-up appointment.
Yeah, that's a good point. So the doctor's actually prescribing appropriately, pharmacists reviewing the prescription, making sure that it looks appropriate based on what the patient's had in hospital, for example, and then, giving them enough and then booking in a review so that if they did need further supply, they could get some more from their prescriber.
Yeah, absolutely.
Yeah. So the RUM project, I read in your article, it doesn't accept sharps or cytotoxic agents, and in some states, Schedule 8 items. So where should we be referring our patients to in regards to how they should be disposing of these items safely?
Well, it's really hard. Unfortunately, in Australia, there's no definitive, consistent scheme that's nationwide available for consumers for dealing with for sharps and cytotoxic agents. So we recommend that people, often these are prescribed at a hospital level or where they're obtaining them, to actually ask what other systems or mechanisms might be in place. And whilst it would seem that it's just logical that it gets addressed by the RUM project, but at the moment, the RUM project, I understand they've had their funding extended for another 4 years, but at the same rate. So they can't sort of increase their capacity to deal with sharps and cytotoxic agents. But a lot of those people are, it's at a specialist level. And so I think it's going back to the hospital at the moment and asking where they can dispose of those safely.
Yeah, that's a good point. So it could be a facility-based wastage or something like that. We do, obviously, at hospital have cytotoxic bins and sharps bins. I guess to wrap things up a little bit, so for health practitioners working in primary care areas, so what are the main points that you want them to take away in regards to the RUM project?
I think really raising awareness. I think what we knew from the other part of the project was that we surveyed sort of almost 4,500 Australians about their awareness of the RUM project, and more than 80% we surveyed were completely unaware of how to dispose of their unwanted medicines safely and appropriately. Most of them had actually disposed of them in their household rubbish or into the toilet or drain. So I think on a positive note, those people said to us that once they knew about the free service that they could access at a community pharmacy, more than 90% of them said they would use it in the future.
So basically raising awareness and then just reminding your patients, have a look at where you're storing your medications, and then maybe a couple of times you bring it all down to the pharmacy and we can have a look at it for you. So Amanda, thank you so much. It's been a pleasure having you on.
Thanks, Jo. It's been a pleasure speaking to you today.
Professor Wheeler's full article is available online at mps.org.au. The views of the hosts and their guests on the podcast are their own and may not represent Australian Prescriber or NPS Medicine Wise. I'm Jo Chia, and thanks for listening.